Even before this pandemic started, I have already been actively spreading awareness about kidney health and kidney diseases through my Facebook page, Hello Kidney by Dr. Carlo Trinidad. And I think this pandemic has changed the way people view and consume health information in general. I have seen an increase in the number of reactions, engagements, and comments, questions on these FB posts. And I think this is due to the fact that people are forced to stay at home and they are not seeing their doctors as frequently as they used to in the past. And so people turn to the internet, to social media, to satiate their hunger for knowledge, not just about the coronavirus or the vaccines, but even for other diseases like chronic kidney disease.
The strict implementation of the quarantine, especially in the earlier months of the pandemic, restricted the movements of our pediatric renal patients, thereby affecting outpatient visits and hospital admissions. Afraid of being exposed to the virus, delayed consults were seen as patients and parents shy away from visiting the clinic, especially if that clinic was hospital-based. The scare of COVID-19 also shortened the duration of face-to-face consults, thereby affecting the provision of patient education. And this was very different compared to the practice that was done in the pre-pandemic era. The strict implementation of triage and the delays in the PCR results release also contributed to the challenge in the inpatient management of our patients, most especially if they were admitted in the isolation wards and if there was a need for immediate diagnostics and imaging.
I think the COVID-19 pandemic is a double-edged sword in terms of its impact on care and disease awareness. On one hand, the devastating impact of the pandemic on livelihood and businesses had people focusing on just earning a living and running their business. And health concerns, particularly preventive health matters like regular doctor visits for those with chronic conditions, took a back seat. On the other hand, everyone became aware of the importance of a robust immune system and how having comorbidities like diabetes and hypertension increases the risk of having a severe manifestation of COVID. Everyone also became aware of the importance of good hygiene practices, and this has helped reduce not just COVID transmission, but also other infections as well. So I believe that all in all, the pandemic has helped people become more aware of the importance of maintaining good health and maintaining a robust immune system.
Life as we knew in the hospital took a 180-degree turn when the COVID-19 pandemic began. One minute, we were seeing over 80 patients a day in our outpatient clinic and in the hospital, walking hours in a day to do rounds and carry out labs. The next minute, we were on complete lockdown with no OPD for months, limited admissions due to the mandate given by our government to be a COVID-19 referral center, and our census dropped to about 10% of what it usually was. This was tricky for patients who needed specialized kidney care because no one else could give dialysis orders or sometimes even adjust medications in our outpatient clinics. Because of this, our division had to devise a way to continue seeing these patients.
So COVID-19 has definitely had a big impact in terms of patient interaction and health promotion. We had to wear more layers and had to have more caution when doing bedside care. I'm sure our patients also felt this. So with a less alaga feel from their nurses, doctors, as well as caregivers. There were a lot of challenges in communication between patient and healthcare workers, since nonverbal cues are minimized with masks, face shields, and limited interactions, and even between and among healthcare workers. However, COVID-19 also scaled up our holistic management as nephrologists. It made us see and deal with more than just the kidney problem, addressing the different issues involved with the said infection. We learned to teach patients not to fear, rather empower them to continue treatments and emphasize follow-up care. We are very lucky that we have a very good peritoneal dialysis program which we can offer to our patients, especially to those who tested positive for COVID and are able to do self-isolation. They can easily continue their dialysis at their own homes.